Hello, welcome back. We're back again with Dr. Manning. He's going to answer some questions. What is a night guard?
A night guard is essentially a dental prosthetic that we use. It helps protect your teeth and your dental work. If you've had any major dental work, crowns, fillings, lots of them, or veneers especially, or if you had a full mouth reconstruction with dental implants, night guard helps protect the work that's in your mouth, the beauty, your smile. It keeps you from grinding and clenching for the most part. What it does is it protects you breaking your teeth from too much force when you're asleep.
How soon can bone loss occur after having a missing tooth?
Bone loss from missing teeth, whether it's extraction or an accident that knocks a tooth out, occurs almost immediately. The very first 12 months after a tooth is lost is where you're going to have the majority of your bone loss, and it's going to subsequently continue over the years.
Are there any alternatives to root canals?
A root canal is designed to remove the nerve from a tooth. So essentially, you needed a filling that wasn't done, and eventually the decay got to the nerve, and the nerve got inflamed. So that's what a root canal does, is to remove the nerve. After that, we cover it up with a crown. But for alternatives for root canals, unfortunately, there really aren't any. The optional at that point would be to remove the whole tooth. You essentially achieve the same thing. You're either removing the nerve or you're removing the tooth. Removing the tooth can also start bone loss, like we just discussed. Removing the nerve preserves the tooth and gives you some more time with that tooth. And that could last 20 or 30 years. But with the advent of dental implants, the second option of using a dental implant instead of a root canal is always available. This is a decision that's best made with you and your dentist. Make that decision as to which is the best way to go. Should we remove the tooth to get me out of pain, or remove the nerve to get me out of pain? That's essentially what a root canal is.
There's a lot of things going on TikTok. And what do you think about oil pulling? And does it actually get rid of your cavities?
It will not get rid of your cavities. I think the misconception out there is that a cavity is a discoloration of your teeth. A cavity is not discoloration of your teeth. In fact, there's some very cavitated teeth that have the same color as natural teeth. And there are some very discolored teeth that have no cavities at all. So oil pulling might give you the impression that you are removing the cavities, but a cavity is caused by a bacteria. So unless oil pulling can kill bacteria at 100%, which is not possible, you don't really get rid of the cavity. I don't even know if it can reduce the cavitation enough to slow it down. It might visually look that way by extracting some of the color from there, but it doesn't mean it's removing the actual decay.
What are the benefits of IV sedation? Do you recommend dental work with or without IV sedation?
IV sedation is a very, very important part of the medical field in general, just healthcare. It allows people who have certain risks involved, whether it's with your heart or your lungs or a few other things like that, to get dental work done or medical work done in general, where the sedation specialist is monitoring and controlling their vitals and keeping stress levels down. The whole point of IV sedation, or moderate sedation as we call it, is to get your anxiety level low enough that I can give you a local to get you really numb and really comfortable without being stressed out over the needles, stressed out over the instruments that we use. So for a lot of our procedures that we do, IV sedation is always recommended. It could be any kind of dental work, but if you're doing a lot of it and we have to keep you in the chair for a while, being sedated to take off that edge, remove the anxiety factor, goes a very, very long way. You're going to be happy, your heart's going to be happy, and your anxiety is definitely going to be happy about that.
What's the difference between snap-on and full mouth implants?
Well, snap-on and full mouth implants, as you probably have seen online everywhere else, they're being advertised similarly as though they're the same thing, but they're really not. A snap-on is essentially a almost full mouth of implants, but it's held up with dentures. The teeth you see in your mouth are essentially regular conventional dentures. They just have a set of implants that you can clip your dentures to. A snap-on is essentially replacing dental adhesive. That on some cases, especially on the bottom, you have to change out the adhesive a few times as you're drinking water and eating throughout the day. A dental implant that allows you to snap your dentures on allows you to go a whole day without changing out adhesive because the gaskets hold them in place. But gaskets are flexible. Gaskets move. They're made of rubber and other types of plastics. So as much as they can move, so can your denture, even though you're snapping them on. So the issue with snap-ons in general is that they are still dentures. They work just like dentures, which means biting into foods like an apple, corn on the cob, things like that are still going to give you some problems. And depending on how you use them, you'll probably have to replace the gaskets at a more frequent rate, 3 months, 6 months, yearly. It just depends on your use primarily. So snap-ons are not the same as a full mouth of implants. A full mouth of implants that is fixed in your mouth is a lot more like your natural teeth, which grew up in bone and is anchored in bone. So when you bite down on something, if you bite into an apple, it actually is anchored and bolted in. So it does not rock, it does not move, it is not on snap. It's only removed once or twice a year for your cleanings. But outside of that, it stays in your mouth, unlike a snap-on. Snap-ons have to come out every night. Snap-ons have to be serviced more frequently. And snap-ons can still not be used like a full mouth of implants. That's fixed.
Do I need to remove my dentures every night?
Absolutely, yes, you do. Dentures, even the best of materials, are made out of plastics completely or resins or a combination of both. Sometimes they have some metal mixed in there, but it's still plastic and resin that is what you see. So most plastics and resins have some level of porosity. Bacteria for them is I-45 or I-10, big freeways. They can get inside there, they can come out, they can just multiply in all the crevices and corners of your dentures. Taking them out of your mouth allows your mouth to breathe. No one was born with a piece of plastic covering the whole roof of their mouth or their gums. So you have to let your mouth breathe. That's one. Also, since dentures are made of plastic or resin, and most people tend to clench or grind at night, if you wear your dentures to sleep, there's a higher probability you will crack them in the middle of the night.
Can I still lose bone with dentures?
Yes, you definitely can and will still lose bone with dentures. The primary cause is that your teeth are out. Since your teeth are out, you immediately start losing bone anyway. Having a denture on and putting pressure on the bone does accelerate the bone loss. So in general, without implants of some sort holding the bone up, you will definitely lose bone with dentures.
That's all I have.
All right.